Hello and welcome back to the EMJ Gold podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. We're back for another episode, and today's edition is a really special one. So with World Mental Health Day just around the corner, it's taking place in 2 days' time, we've invited a guest who is really passionate about improving outcomes in this therapy area and addressing unmet needs.
Yes, a very important topic indeed, and we're excited to be joined by Nedim Pipic, who's the Senior Vice President and Global Therapeutic Lead for Mental Health at Boehringer Ingelheim, who joined you, Isabel, virtually for this interview in aid of World Mental Health Day. So, what can you tell us about our guest?
Yes, so Nedim has been in his current role since August 2022, and he works within the central nervous system, retinopathies, and other emerging areas. One key focus is schizophrenia, and his team is actually currently running an awareness campaign to dismantle stigma around this condition, which is another reason why we are really keen to talk to him today. He's also a medical doctor by training, so he's got direct experience with patients, and he holds a degree from the University of Vienna.
Amazing. Yeah, that campaign that you mentioned there is really impactful and it's definitely worth checking out. So we'll be sure to link that in the show notes for you to go see for yourselves. But in this conversation, you look broadly at the issues facing all people living with serious mental illnesses and how pharma can play a role in improving diagnosis, treatment, and quality of life. That's right?
That's right. Well, without further ado, let's listen in. So Nedim, welcome to the podcast. It's lovely to have you on. How are you doing today?
I'm doing great and a pleasure to be here. Thank you for having me.
Well, no, thank you very much for joining us for which is going to be our World Mental Health Day special episode, which will be coming up in 2 days' time when we release this. And we're really pleased to have you on because in your role at Boehringer, you lead the strategic direction of the central nervous system portfolio, and you've got a really high focus on addressing unmet needs in severe mental illness. So I feel like you are very perfectly placed to talk to this topic today. We're going to cover a huge range of things, but I thought we could start off with looking at how mental health has become a bit more of a mainstream conversation in recent years. I think most of our listeners could definitely agree with that. What key indicators or shifts have you seen that kind of notify or signify this change in how we discuss and approach mental health?
Well, I think what everybody is aware of, the impact of the COVID-19 pandemic and a lot of the ongoing geopolitical, societal events at the moment, they have had huge impact on people's mental health. And something which we've all been reading in various media channels. So there's been significant progress in definitely normalizing discussions around, call it the more common mental health conditions, such as stress, anxiety, also mental health well-being. So this is being much more openly discussed in the public. But while awareness and attitudes around those conditions have improved, when we think about more serious mental illnesses like major depressive disorder, bipolar disorder, schizophrenia, those are being left behind. Those are the ones which is still hard to talk about. There's misconception. There's definitely also certain stigma around them. This serious mental illness areas, that is exactly what we care about at Boehringer Ingelheim in terms of research focus and in terms of really improving the whole mental health care setting in that area. And when you think about it and you really think about the impact, one reason was COVID, but I think the other reason is through those discussions, it became apparent mental health diseases, mental health illnesses, they are a global pandemic if you look at it. 1 in 8 people, so almost 1 billion people around the world are actually currently living with a mental health condition. And sadly, statistically, 1 in 2 people will experience a mental illness in their lifetime. So you can imagine how much impact that will have on the society. And if we add the impact that also mental health can have on the global economy, we are talking around $1 trillion per year lost in productivity due to that burden. And we're only talking about 3 diseases in that case: anxiety, stress, and depression. And it will not stay at that number. It is statistically expected to rise to almost 6 trillion. So it will grow 6 times by 2030. And I think this is a topic which has to be openly discussed. addressed and improved.
Absolutely. Some pretty stark statistics you mentioned there. And interestingly, I think the theme of this year's World Mental Health Day is around talking about mental health in the workplace. And you touched on the impact it can have when people are not able to discuss these conditions, and it can lead to absences without proper resolving of the issues. So, yeah, I think it's such a far reaching complicated challenge, mental health, and obviously the pharmaceutical industry is tackling a very specific part of it, which is those more serious illnesses, as you say. Why do you think, the conversation around conditions like schizophrenia is so far behind talking about stress and anxiety still?
As briefly mentioned, it is the topics of mental health being and stress and anxiety. It is something tangible, and if I may say so, something slightly lighter to discuss and address. Serious mental illnesses, they are shrouded in still, let's be honest, in a lot of stigma and misconceptions. So while on the one hand we improved on the mental health awareness, stigma around the serious mental illnesses is actually worsening. If we look at what England, as an example, European country, well advanced in terms of both communication, mental health care topics, almost 90% of the people in UK with serious mental illness, they say they experience stigma and that this has actually stopped them from doing the things they wanted to do. So I think that's one of the key topics, because those mental health problems and the fear of potentially disclosing them to friends or family or when applying for a job, that's a big topic that needs to be addressed. And you briefly mentioned schizophrenia. Um, Maybe to deep dive in that one a little bit, schizophrenia is a disease that affects 1 in 300 people, almost 24 million people worldwide. And actually, looking at another country like Germany, a study that has been done in the last 3 decades found that actually all measures that have been done have not worked on reducing stigma, and the stigma towards the condition of schizophrenia has worsened. People would even recommend someone living with schizophrenia less for a job. Mental health professionals seem to still have a negative attitude to it. So I think those topics are serious, and those topics are also further increased and fueled by the misrepresentation in the media, which can add to the discrimination, which can add to the social isolation. So I think that's just not affecting the people, but also the loved ones, the communities, the whole society, and something which is the key reason why actually it is a topic we still have to deal with, and it is not improved.
Yeah, I think you're right. Of course, there's a hierarchy in a way linked to how common these diseases are. Everyone talks
Yeah.
about having stress and anxiety over their lunch, but schizophrenia isn't something that comes up with so much readiness, or any disease like that. So yeah, you're completely right on that. And something I found interesting when looking into this interview was that, people often don't get diagnosed with serious illnesses because of the stigma around them, because of the fear of admitting, perhaps even to themselves, that they could have this condition. So what role can the pharmaceutical industry play? Because of course we all want earlier diagnosis of any condition, especially mental health.
If I sum it up in one sentence, it's all about education in this case, and something which will not take a few months. It will be something that has to be done across the next years. And pharma can really help on the educational side to help reduce stigma, to help normalize attitudes towards serious mental illnesses. So education is the one part. And the other part is really changing policies and practices to address the misconceptions and discrimination head on with concrete actions within the society. Because the problem is, if you look at stigma, it's pervasive across all society elements. When you think of homes, of schools, of workplaces, there's a lot of misrepresentation there, especially when it comes to serious mental illnesses. And stigma, you mentioned it in the beginning of the question, is also something, when you look at the latest research, is a major barrier to actually people accessing quality and timely diagnosis, treatment, and care, because they are not daring to go out and ask people for help, be it the healthcare professionals or be it their caregivers and being those in the family closest to them. And I think this whole social isolation has an impact beyond the treatment, because then for those affected, it's harder to find work. it's harder to live in decent housing, and it's also harder to socialize, to maintain friendships, to have romantic relationships. So it's really this everyday functioning is a huge burden on those people affected with serious mental illnesses.
And you touched on education there. Is there anything that you've particularly worked on in your role in Boehringer that you're really proud of and you think's made a difference?
Yeah, I think it's a it's a good question, because I'm always a fan of. We started a big disease awareness campaign, looking beyond stable in schizophrenia. I'm always a fan of looking at it across a longer period of time. But now, at least after half a year, um, I could have a few parallels on seeing how some of the awareness and how some of the critical hurtful truth points around uh, schizophrenia have been raised by this looking beyond stable awareness campaign.
Mm.
With this looking beyond stable campaign, we really look at people with lived experience at the front and center of the campaign. And that is the key difference maker, to truly show it from a perspective of the patient, from a perspective of those who really know it the best.
Mm.
Um, and also make it very immersive. So we would have examples of going into a room of someone living with schizophrenia who we think is stable, but actually still cannot fulfill daily tasks. The
Mm.
same is true to show how they are actually functioning or not functioning in daily life. So to go a little bit behind the scenes and show it from a perspective of the patients.
Mm. That sounds really interesting. I'd love to know a bit more about that, perhaps after this conversation.
Yeah.
I think media misrepresentation also plays a big role in stigma around serious mental illness. It's clearly a character device that's often used all over the shop. So, you touched on how personal stories can help to dismantle this. How important is it for people to share their experiences? You touched on lived experiences. It's clearly important, but how do you convince people to do this? How do
Mm.
you make it feel like a safe space for them, I suppose?
And that's basically the key point, is sharing experience is the key driver of connecting those who live with the mental health conditions with those without. So I think if you look at the Lancet Commission, for example, did a study, and they've seen that the best ways to reduce stigma is through social contact,
Mm.
connecting those who
Mm.
live it with those who maybe have not seen it, who do not understand it, and that drives high acceptance, that drives high understanding of the mental illness. So I think that's the key driver of experience sharing, to inspire others to understand and empathize. The word empathize is so important, to see how can we help those affected? How can we help their loved ones to live a fuller and more productive life? So I think those are the key points which can really make a difference. And some countries in Europe have already done a good job in driving that. So there's also some concrete examples to that.
Which countries are doing particularly well? Could you give us any examples?
Yeah, I know. I teased that question out, I know, but, but if I think of one, and I'm really proud of country Denmark. We as a family live there, and they've been always front and center in addressing topics which are difficult to drive with good awareness campaigns. And in Denmark, they had this One of Us national anti-stigma program that actually trains volunteers who have experienced mental health conditions to act as ambassadors. And that helps address misconceptions about mental health, but also proactively have those who really have lived experience talk about it openly, and also trained to drive it and train others to really address the topic head on.
Yeah. And we've kind of spoken a bit more about the public there and public misconceptions, but stigma does even exist amongst healthcare professionals, which is obviously an audience, a group of people that you guys have access to within the pharmaceutical industry and a certain amount of potential influence. So, how can you make sure that there isn't stigma at this really crucial touch point between, patients and the healthcare system?
Yeah, that's clearly another key point, because when you look at psychiatry, um, as a specialty, has an image problem. So for many, psychiatry is still seen as call it the black sheep of medicine, you know, a field with low pay, very little innovation, and potentially when you're a young physician, that makes it unattractive. So I think in a research which we've done as Boehringer Ingelheim, we did found that there's a lack of psychiatrists entering the professions versus those leaving it. And I think that is one key topic. This under resourcing in mental health care is a general topic across both developed and developing countries, where there's just lack of personnel, be it psychiatrists, being nurses, being psychologists. And I think that definitely poses an issue in the healthcare professional setting. Um, the other part to keep in mind, I briefly mentioned it in the beginning, but there's still, even among the healthcare professional, there's negative attitudes towards mental health illness, still some judgmental language, potential discriminatory behavior. So that can make people affected even more marginalized and more likely to actually discontinue seeking the treatment. So there's a lot that can be done there to both recruit and retain mental health professionals, but also to make the profession itself more attractive and a more viable career option. So also there, awareness is a key driver, but also changing the attitudes towards how to treat patients competently. That's still a big area to work on.
No, that's really interesting. I hadn't thought about it in that perspective. But yeah, you're so right. I've heard often the lack of resources, or that, it's one of the first services to get cut. So it is a really difficult profession to work in, but arguably it's one where you need the most talented and, the doctors with the biggest scope. So yeah, I completely see the challenge there. Looking ahead, I suppose we've covered kind of where we're at the moment in terms of mental health. And it does seem to be a mixed bag in terms of progress, but also still a number of challenges to overcome. I think there's still a long way to go. What are your hopes for how society and the healthcare industry are going to treat mental illness in the future? Obviously, we hope that stigma will no longer exist. And everyone will feel comfortable to say they've got this, that, or the other, whatever the illness tends to be. But what needs to happen to change to sort of make that narrative a reality?
Well, that's a big task. That is clear. If I had a vision, imagine a world that in 10 years we have a more inclusive, we have a more supportive society. There's, acceptance for people living with serious mental illness and their loved ones. So that is definitely the vision that I would see. And it does paint me positive, even if it's a big task, that when you look at some areas we all know of, it is doable to reduce or really take away the stigma. For example, we've seen it in HIV, we see it in ADHD or autism spectrum disorder. So it is something that can be addressed if done by all stakeholders, right? Certainly, pharma has a key role to play there in terms of the education. I think also a lot that from a Boehringer Ingelheim perspective, we will do a lot on the World Mental Health Day of sparking a lot of thought with real world stories from those affected with serious mental illnesses such as schizophrenia, for example. So this vision to in 10 years have this more inclusive, supportive society with more acceptance, I wouldn't say it's impossible, because we've seen it happen in other areas. But one thing is education. Another thing is definitely from a governmental perspective to support better mental health, also from governments committing to address the United Nations 2030 Sustainable Development Goals, where improving mental health care is one of the key imperatives. That change also will require additional investments. As we mentioned, there's a lack of necessary resources for effective implementation, for effective impact. So sufficient funding to ensure that these mental health strategies can be executed on, and especially that the care and treatment of serious mental illnesses can be met, is another key point. And as I said, I think from a pharmaceutical perspective, we all need to commit. At Boehringer, we made a long-term generational commitment to actually invest in redefining mental health care, because there's still a long way towards improving outcomes for people living with serious mental illnesses. Next year, we can already go the next step and call on global and national political stakeholders to have a clear action plan ahead of the mental health and NCD UN high-level meeting in 2025. So it's really going step by step to try to address it towards, as you said, in the next 5 to 10 years to really see improvements.
Well, I think what you just outlined there, Nedim, is a pretty solid strategy. So hopefully someone's listening to that. To conclude, I'd love to know, what's your personal passion for working in this area? What gets you up every day to be working in mental health?
Sometimes there are topics which are hard to talk about, but I mean, when I lined up the statistics in the beginning, 1 in 8 people have a mental health condition. 1 in 2 will have it in the course of their lives. Obviously, I'm also affected with those close to me that need and needed help. I think that was and still is one of the key drivers for me to say there's so much more that can be done, because as a caregiver, as someone close to a person living with the experience, you feel it on your own skin. You really see how much needs to be done on the awareness side, on the stigma side, on the improving the healthcare delivery side. So I think there's this personal connection that I have to it. The other side is when you talk to patients, when you talk to those who really have to deal with it every day, and when you're welcomed with open arms in terms of, please help us find consistent solutions that can help us address it, be it from the awareness or be it from the treatment side. So truly the whole patient journey. This is where you see, when you see that unmet need and how much can be done with small things, with big things, this is what motivates one every day. So I think just for all of us, just talking to those living the experience can already make a true difference, because you realize how big the unmet need is, and you realize how open everybody is to accept help. And I think the same is true also when you talk to physicians and their wish for more innovations and their wish to find other ways to truly help patients. So
Well, thank you
those are
very
my
much. Thank you so much for sharing that. I think that is a lovely note to end on, Nedim. And thank you so much for joining me for this World Mental Health Day special of the podcast.
Thank you so much. And thank you for having me.
Well, that was a really insightful episode. We so often focus, I think, on physical health conditions on the podcast, so it was really interesting to look at challenges in mental health specifically, of which, sadly, clearly there are many. Did you have a favourite insight from your conversation, Isabel?
Yeah, there was loads. I really enjoyed my chat with Nedim. I think what he was saying about changing the stigma around mental health and how it's really a team sport, how industry and healthcare systems and governments need to work together, especially in light of the fact that health budgets are so under pressure. It's harder and harder to get mental health professionals. So yeah, you can see why there's certain inequalities in this area that then leads to, worse outcomes ultimately.
Absolutely, yeah. Budgeting issues, especially in our home country of the UK, and especially poignant. I found it really interesting to hear how Denmark, for example, managed to move the needle there when it came to mental health. I thought it was also really important at the end of the episode when he talked about his personal passion for this area of healthcare. I think we've all been touched by mental health in some way or another, and it's really important that it is a topic of conversation that is brought to the table rather than just a taboo that's never mentioned.
Yeah, could not agree more with that. And in the spirit of that, this year's theme for World Mental Health Day is it's time to prioritise mental health in the workplace. So I would urge all of our listeners to take that message forward into the week, take it forward into your workplaces, and think about how you can foster a more open and accepting work environment around mental health issues.
Yep, a really important note to end on, I think.
Absolutely. So that's it. We hope you enjoyed it. Thank you for tuning in to this special World Mental Health Day episode. As we said at the start, it's coming up in 2 days' time. So however you will be marking it, we hope that goes really well.
See you next time.